Good day, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of August 15, 2022. Dr. Esther Ellis is joining me on behalf of Health Commissioner Justa Encarnacion this afternoon for the latest COVID-19 data and information on where Virgin Islands residents can get a COVID test, vaccine, and booster shot. I also have VITEMA Director Darrell Jashin here to provide a tropical weather update now that we are in the unofficial height of hurricane season, and also to let you know where we are on sargassum. But before I go there, I would just like to take a couple of minutes out to thank a very, very, very grateful Virgin Islands for showing up for the burial and interment of Governor Dr. Charles Wesley Turnbull. Thank you for coming out and showing your support on each island while he laid in state, and thank you for coming out on Saturday for the actual funeral. Whether you sent a kind word, made remarks, attended the candlelight vigil, or just showed up to witness, thank you for all the support that you have given his family over this period. I would also like to thank the Honor Guard of the National Guard, Turnbull's Funeral Home, the people who assisted with all the preparations, the caterers, the foods, the gentleman who created the tomb, Public Works, and many, many more who participated in this auspicious occasion. He was a giant of a man, and we will miss him dearly, but he was sent off in grand style. That is required for his level of office and for his level of service to the people of the Virgin Islands. To his family, I hope that God grants you peace, knowing that he is someplace better today, doing what governors will in heaven. Well, August 15th is what we look to as the beginning of the height of the hurricane season. And in our effort to keep the community ever prepared for and informed, our VITEMA Director will join the Government House Weekly Press Briefing every Monday to provide the latest weather updates and information on our local response to any impending weather events. So without any further ado, I will go to Director Darrell Jashin of VITEMA. Darrell.
Thank you, Governor Bryan, and good afternoon. I'm going to talk about the sargassum update first and then go to the August 15th updates on the weather situation. So the current threat of the sargassum seagrass influx to the water production decline at the desalination plant located at State Richmond on St. Croix is very real. For the past 4 weeks, the production has struggled to maintain the maximum output of 3.7 million gallons per day and has gone down to as low as 2.6 million gallons per day, or a reduction of 30%. The demand for the consumption is such that WAPA is generating barely enough water for each day. The water storage level is between 3.5 to 4 days, which supports approximately 50% of the homes and businesses on St. Croix. WAPA and 7 Seas, who operates a desalination plant, took immediate action beginning 18 July to eliminate daily as much of the floating sargassum as the intake lines, but must constantly take the units offline to clean those lines. The 7 Seas has even contracted with the crews and divers to go down to the intake lines and entry points to clean the sargassum influx. Under the federal emergency declaration approved on July 25, 2022 by President Biden, the federal government, with Governor Bryan's approval, contacted local businesses to determine capabilities using direct federal assistance to remove the sargassum threat on the shore nearest the desalination inlets. Since the beginning of Operation Safe Water in July, we've watched the change of the sargassum life cycle to the point now decomposing sargassum in the water is such that the coffee ground sized particles are passing through several of the water filtration and put the 7 Seas the desalination plant is actually taking longer now to clean these filters. The next step is to remove 1,000 cubic yards of sargassum from a 400-meter shoreline and the water with disposal at the VI Waste Management Authority and Angola landfill. The Joint Agency Task Force met last Friday at the site with the contractor, who's VVOT, to ensure a thorough coordination with each agency. We included U.S. Fish and Wildlife and DPNR to go over both the environmental protection and turtle nesting preservation efforts. VVOT is working 7 days a week from 7 o'clock in the morning to 7 o'clock at night and hopes to eliminate the continued threat to the St. Croix water production. This action is in hope to increase production level back up and reduce the stress on equipment that is running near maximum limits. 7 Seas has had to go out to 24-hour operations and bring in additional staff to St. Croix from some of their other plants. And the good news is there's no immediate new sargassum threat of the mats identified in the Caribbean and the area working on St. Croix or St. Thomas desalination operations. The team is working with several academic and federal agencies to provide a form of future modeling to provide some advanced warning. The influx predictability has a ways to go and is very similar to the complexities that are involved with the path of an oil spill. We are going into uncharted territory, so to speak, and have developed many new partners who would like to assist not only the territory but the entire Caribbean. As we're breaking new ground on this immediate response efforts for this new type of threat to the critical infrastructure, the same incident command system that we've been using from any serious threat and role for an incident commander, DPR Commissioner J.P. Oreo, has been critical to our success. Part of the FEMA's and our federal governors' partners' efforts is to include the U.S. Army Corps of Engineers, NOAA. They are developing short-term and long-term course of action or playbooks to combat the next sargassum threat, which appears to worsen every year in conjunction with climate change. On a very positive note, yesterday's water output was 3,289 gallons, or 88.89%. And OAPA added 561,702 gallons to its water storage tank, which now represents 4.2 days from a low of 2.6 days on 26 July. All right, Governor, I'm going to transition to the hurricane season now. So today, the 15th of August marks the start of the height of hurricane season, and for the next 60 days, until October 15th, there's a marked increase in any tropical wave coming off of Africa becoming a tropical cyclone. However, the current dry air and high-pressure system in the Atlantic are keeping the formation of tropical cyclone very low for the next 5 to 7 days. FITEMA wants to remind you, be prepared, stay informed, and be vigilant. If you've not done so yet, be sure to prepare your personalized family and business kit. Include in your first aid kit medicine, radio, batteries, some cash, bottled water, non-perishable food items, toilet paper, a can opener, matches, a whistle, and if you own a pet, some pet food. It's always best to shelter at home or with friends and neighbors who have a solid structure to withstand a hurricane storm force winds, which begin at 74 miles per hour. FITEMA, in conjunction with hurricane, will provide a hurricane watch message 48 hours prior to the onset of hurricane force storm winds, which is a signal to begin your final preparations if you've not done so yet. FITEMA will issue a hurricane warning 36 hours prior. In some cases, the rapid strengthening of the storm, FITEMA will only issue a warning. Do not delay or second-guess these warnings. Make every minute count in your final preparation. Act before it's too late. If congregate shelter openings are announced and your home is not safe to withstand hurricane force winds, bring your chair, an emergency kit, a blanket to the nearest shelter. Again, FITEMA reminds you to be prepared, stay informed, be vigilant. Thank you, Governor.
Thank you, Director Johnson. And now we'll go to Dr. Ellis for our COVID update. Dr. Ellis.
Good afternoon, Virgin Islanders, and thank you, Governor Bryan, for the opportunity, as always, to join you to provide an update on COVID-19 and monkeypox for the Department of Health. Our latest COVID-19 numbers show we have 189 active cases in the territory. 116 of those are on St. Croix, 68 on St. Thomas, and 5 on St. John. Our positivity rate is down to 6.5%. Hospitalizations territory-wide are 7, 3 on St. Croix at JFL and 4 on St. Thomas at SRMC. None are vented. Please note that we do have the presence of the newest variants, BA4 and BA5, and the best protection against these variants is to remain current or up to date with the recommended COVID-19 vaccine schedule, including boosters. Vaccines are recommended for all people ages 6 or older. As a reminder, our COVID-19 vaccine schedule is that, and the vaccinations take place as part of our regular Department of Health clinic schedule. For testing on St. Croix, we have Monday through Friday, 9:30 a.m. to 10:30 a.m. in the Charles Harwood Memorial parking lot. On St. Thomas, Monday, Tuesday, Thursday, and Friday, 9:30 a.m. to 10:30 a.m. at the Schneider Regional Medical Center loading dock. On St. John, Wednesdays from noon to 3 p.m. Presently, the St. Croix MCH Clinic provides both immunizations and COVID-19 vaccines, and they've been relocated to a temporary tent adjacent to the Charles Harwood Memorial Complex. Services are provided on an appointment-only basis. The phone number for appointments or information is 340-244-0016. Regarding monkeypox, the USVI has had 8 suspect cases so far, and there have been no confirmed cases to date. The Department of Health has provided training to both hospitals in regards to infection control and potential ER visits. Additionally, we will continue to provide education to the providers in the territory and keep the public informed of any confirmed cases. Vaccination will be used for post and pre-exposure prophylaxis. We are preparing to have vaccinations available to certain populations and will announce this week with careful consideration of our current supply. We currently have 160 Jynneos vaccines in the territory. We will begin vaccinating individuals by Monday of next week and let the public know the schedule for that prior to starting. We will also begin testing suspect cases at the Department of Health next week, and again, let the public know the schedule for that prior to starting. We are taking this opportunity to update the public on our Charles Harwood construction project. We are ecstatic to announce that we have completed our first community engagement event on July 30th and the CZM public hearing this past Friday, August 12th. We look forward to the follow-up hearing in 30 days. The lead and asbestos abatement and demolition phase of the project is scheduled to begin mid-September and is projected to be completed early June 2023. Construction is scheduled to begin September of 2023 and is projected to last 3 years. Therefore, the new facility will be ready for occupancy in September of 2026. As usual, the DOH is busy at work ensuring that the public health is a priority. Thank you again for the time to share this information with the public. Now back to you, Governor Bryan.
Thank you, Dr. Ellis. And so much is going on in the Virgin Islands right now. I just want to give a little shout out, or actually a big shout out to our Department of Public Works, who is doing just incredible jobs with paving. And last week in particular, they won a grant, $25 million. This is really great because it now completes the funding to take the Veterans Drive around the legislature in St. Thomas and all the way down to the Tortola Wharf, as we call it, to the seaplane. So this is fantastic news for the territory, and it just gives us another place to walk, enjoy, and experience the Virgin Islands. Now, speaking about walking, we are in the final 2 weeks of our Best Lives Walk Out Wednesday. This is a program that I want to encourage all of us to get with and to stick with, and let's finish it strong. On St. Croix, we changed venues for the final 2 weeks. We begin at Canigata Ballpark right here in Christiansted. We go up the bypass, down Kin Street, and back to Canigata again. On St. Thomas and St. John, the venues remain the same. Griffith Park to Yacht Haven and back on St. Thomas, and from National Park to Canal Bay and back on St. John. I'm going to make sure that since next week is the last week, I don't know how I'm going to do it, but I'm going to figure out a way to get to St. John and make sure I do a walk on each island. So hundreds of you made the decision to become more physically active and joined us every Wednesday for this walk in the late evening. And my greatest hope is that each of you continue to do this beyond Walkout Wednesdays as part of your health wellness journey. And the goal of this initiative really is to give you the tools to begin the work in getting in shape, getting your life back together, and just feeling all over energetic and healthy. People ask me how I keep energy. The best way to get your energy is to exercise, exercise, exercise. Your body will do exactly what you train it to do. So if you train it to eat and sleep, that's what it will do. But if you train it to be out there, get an exercise, it'll crave it more and more. But today, I'm excited to announce that Our Best Life Health will kick off a new 6-week program. This is a new one now, just for our seniors, called Workout Tuesdays and Thursdays. So beginning August 23rd from 9 a.m. to 10 a.m. every Tuesday and every Thursday, I'm encouraging our seniors to start your mornings right with our free fitness and aerobics classes tailored just for you. The classes will be at the Altona Lagoon Fit Lot on St. Croix. That's right up by Lagoon. There's an AARP joint venture thing we did, a little park we did there in Altona. It's going to be there from 9 to 10. And then St. Thomas Emancipation Garden, can't miss it. And then Sports Parks and Recreation Center on St. John. So that's 3 locations, 1 on each island. And if you can, register online at ourbestlifeusvi.com. That's ourbestlifeusvi.com to get your free t-shirt and other goodies we'll be giving away. Just bring a big towel when you come, and we will take care of everything else. So that program begins, and it ends on September 29th. I want to thank Commissioner Cal White and his team at the Sports Park and Recreation for their hard work in putting these programs together. For more information or assistance with any of these programs, please call the Department of Sports, Park, and Recreation at 340-773-0160. Now, before we close this afternoon, I have some really exciting news that I want to share. You see, when Tregenza and I asked you for your vote of confidence in 2018, we promised a lot of things. But most importantly, we promised to stabilize the government's finances, bring transparency, and restore the people's trust in their government. We went to work and made good on these promises, and we stabilized the finances of the government and addressed many long-standing obligations like paying off the government's debt owed to WAPA, repaying the 8% cut owed to government employees, bringing solvent the GRS, and getting caught up on outstanding income tax refund payments to Virgin Islands families. It was not easy, and it did not happen overnight, and it didn't happen alone. It took all of us together, and it took meticulous planning and sound budgeting and to making this government's revenue generation operations more efficient so we can collect more. But together, working with our friends in the legislature, Stacey Plaskett, and you, we did it. We brought it together, and we brought our government to a place where we can begin to address another long-standing obligation in a real meaningful manner. In my State of the Territory address earlier this year, I committed to calling for the appropriation of at least $25 million each and every single year to address the retroactive wages owed to the government employees for over 30 years now. On July 12th, I submitted legislation to the 34th legislature to effectuate the first such payment. I have worked closely with Senate President Donna Fred Gregory and Senate Vice President Novell Francis and their entire caucus at the legislature to get this done. Now, they have championed this cause, and they have been supporting the administration in this endeavor. However, after a joint review of our projected revenues and expenditures, I believe that we have the wherewithal to make a larger initial payment. Therefore, I sent correspondence to the legislature earlier today after working last week with OMB Director Jennifer O'Neill. I'm having a senior moment. Jennifer O'Neill and the Senate President Donna Fred Gregory. We figured out that we could forego some of the things we want to make sure that our seniors are a little bit more secure. And today, I forwarded correspondence to the legislature asking for that appropriation to be increased to $40 million. Now, there are still pressing obligations in our community that need to be met. But the pressures of inflation are being borne disproportionately by our residents living on fixed income. So this opportunity and every single opportunity I have to do a little bit for us seniors who cannot go back out to work, who cannot just pick up and say they're going to take on another job. Those are the people that's feeling this increase in inflation the most. So we're going to take this opportunity to pay as much back wages as we can to those workers who are retired or near retirement. And it is timely and indeed a blessing from God that we can do this right now. Because truthfully, there's nothing we can do really to reduce gas prices or food prices. We do not control the federal monetary policy or the global events that are driving inflation across the globe. We can, however, give priority to investing local resources back into our people when opportunities such as this present themselves. We have identified the means, and I hope that the members of the 34th Legislature join us with Donna Fred Gregory, Nobel Francis, and their caucus, and will exercise this big step in retiring the obligation owed to our public sector employees while providing them with a timely financial stimulus. This $40 million will reduce the total owed to $135 million. Still a considerable amount of money that we owe, but we as an administration are dedicated to seeing it through and ensuring that we pay back the money owed to the people. And we feel good and confident that we can do this at a time when people are most stressed by the price of food, gas, energy on a whole, and just the cost of living around the globe. But here in the Virgin Islands, we will continue to put our money where our mouth is and support the most important people, our residents, our seniors. So this is one of the initiatives that we're using to fight inflation. Also look for the premium pay coming out. We have 2,600 checks out now and about $4 million. So we're just about through healthcare, and you will see the other industries start to roll out a little faster, including those who work for the government. So doing everything that we can to make life just a little bit better for you. I'll take some questions from the press at this time. I see we have Lasiba Knight in the studio. Good afternoon, Lasiba.
Hi, good afternoon. How are we doing today?
Fantastic.
Awesome. So I have two for Dr. Ellis, and I'll start with you if you don't mind. Given the fact that COVID became endemic in the territory and essentially nationally, do you expect that monkeypox may become endemic here?
It's really too early to say, to predict that. We have yet to confirm a case in the territory, and there are efforts underway already stateside to curb the spread with pre- and post-exposure prophylaxis with the vaccine. We do have a vaccine available actually much sooner in the case of monkeypox than we did with COVID-19 because it's related to chickenpox and smallpox, and so it was a well-established vaccine that was easy to change so that it specifically targeted monkeypox and roll out very quickly. So my short answer is I don't know.
And can you describe how DOH arrived at the conclusion that there were 8 suspected cases in the territory?
Yes, definitely. So epidemiology, one of the things we do is surveillance, and any suspect case in the territory is reported to the epidemiology division, and samples are collected, and we are responsible for either testing those samples locally if we can, or sending them to the CDC or CDC Puerto Rico, or working with providers to send samples to LabCorp. LabCorp in Florida also can test for monkeypox, and then keep track of whether specimens are confirmed or not. The rash can look similar to other diseases, so it's important to obtain a sample. It's actually a swab of the rash and test it for confirmation.
So generally, it appears like people are self-presenting, and then samples are being collected.
Yes, those samples are from all over the territory, from many different providers. If you're a provider and watching this and you want to be able to test for suspect monkeypox cases, reach out to me, because we've been working with the providers. As soon as they get a suspect case, they can call Epi or me or anyone from our team, and we'll send instructions. We've been sending instructions out, but in case somebody doesn't have the instructions, we can work directly with the providers to make sure a sample gets collected quickly, and then we can either confirm or rule out that suspect case.
Awesome, thank you. And then Director Joshin, for you, are we over the worst with sargassum? And the predictive model that we're working on putting together, has that been put together? And are we tracking anything coming to the territory currently?
I think the biggest thing now is we're learning a lot in the process and pulling in the academic as well as some of the professionals, especially with U.S. Coast Guard, for example, with the knowledge in oil spills. We're moving in the right direction. There's still some work to be done. I think there's a firm in France that's been doing some activities down island. We're good to work with. I think right now we're looking at what may happen next year, and we see this cyclically coming through. Right now our immediate threat has been reduced quite a bit, but we're still going to watch what happens out there in the Caribbean. As you know, a lot of it's going to come in from the east. I mean, the threat is still out there, not just for the territory, but any other islands that are down there. And our hopes that we'll work together also, not just the territory by itself, but other agencies, academic groups, and the federal government to come up with a good solution.
Awesome, thank you. And then Governor, for you, can you describe the economic situation that we're in where a $40 million payment in retroactive is possible? And then you mentioned that some things may have been left on the back burner, other priorities to get this done. So if you could just briefly describe what may have been left aside.
Well, you know, we definitely want to make sure that we speak to it, but right now we have had over the last 2 years an aggressive road paving campaign. That's going to hurt a little bit because we're doing things like paying WAPA, trying to keep the light bill down, and paying this as well. I don't think every time we do something, it's like the $17 million that we set aside for the dredging of the harbor. People always mention other things that could have been done with the money. But we have to prioritize what we pay for, and we make choices every day. One of the things that comes to mind is waste management. We owe considerable amount of money still. JFL, Juan F. Louis, their cash position, they move is very weak every single day, and we monitor that as well closely. We just gave them $10 million, so it improves that a little bit. But for the most part, I think we've got things covered. Right now, we have a situation with WAPA in terms of the water bill, 2 7Cs that they need to pay, as well as VTOL. They have a lot of vendors still barking down their throats. So it's good to see gas prices going down, and we're going to pay those people, but we're not out of the woods there yet either. So lots of things in the Virgin Islands that need attention, but I think the tremendous rise in inflation has really put a burden on our seniors, and we want to make sure that we're going to be attending to them. We're also working on another payment that will pay all our Social Security seniors, just every little instance where we can, to make sure we can give them a little bit more money. At this point, we're processing so many checks out that we don't want to announce more money that's coming out because we have more, but we're trying to get the premium payout, and that's coming out really slowly. We're asking the employees, please send in the W-9s that we're requesting so we can get your employees paid. We need those W-9s in order to make the payment complete. So we're getting those out as fast as possible. We are at 2,600. I think we got 20,000 checks to send out. And that's at the same time, we still got to send out this retro, if and when it's approved, as well as $25 million in taxes at the beginning of September as well. So, as well as the retro payment for the teachers and other things that we're processing at the same time, trying to make sure as we close out the fiscal year on September 1st that we have it. So what we did is we had what you call a supplemental bill going to the legislature to add additional resources for departments. We decided to forego some of those changes where we were seeing budget savings and take that money and dedicate it now to paying this retroactive pay that's over 30 years old.
And then just one final thing. As you speak, you're addressing a lot of like long-standing issues that have real systemic causes or factors. You mentioned WAPA and the fact that it's an unending payment there. You got one under, like, seemingly completely done with GERS. The hospitals, that's not done. You know, there's a lot of issues there that are systemic. And the money is, like, amazing. The money is great. But those systemic problems, especially with those two huge institutions in the territory, what can we look for there?
So, I mean, that's a great question, Lasiba. And for one time, we're not really throwing good money after bad. I mean, you know, I can't tell you how much it pains my heart every time I cut a check to WAPA. It really, like, I just can't express the frustration there, but nobody can predict that the light bill, the energy cost would go so high in terms of the fuel. But the good news is that all of these things are just the darkest part of the tunnel before the break of dawn with the light, because WAPA has the money to totally fix itself. JFL Juan Louis is going to open up the new JFL North. The rebuild is going well. Construction should finish on all of the extra stuff that they have to do this month. They did have a delay on their water tank, but we're working around that, trying to use the existing cistern until that water tank gets in place. And the thing that I'm saying is we're just going to move, because at JFL's North worst, it's still better than what we're in now. And I think what the management and the board is trying to do is make it perfect before we move in. But let's get real. JFL North has indoor plumbing, indoor bathrooms. So it's got to be better than where we're at. So we're just pushing the envelope and getting them, once this little final piece is done, just to move so we can, because right now we had a chiller down last week. We're trying to get a new chiller. That place has, in the old hospital, the new one, the chiller was working fine. The operating rooms work fine. All of these things work. All we need is this medical gas. So I'm going to put a lot of pressure on the board to move and get that done. And then we could start thinking about how we get the old hospital demolished out of the way. Plans are already being drawn up for the new one. So all that's good stuff.
Awesome. Thank you very much.
Thank you, Lasiba. I think Susan.
Good afternoon, Governor.
Good afternoon.
Just to clarify a little bit on the $4 million, did you say you're going to break that into between the 8% that and the ERS? Is that what?
No. We already paid back. We already paid back the 8%. The GRS is fixed permanently. These funds are, it's somewhere around 1989, 1990. The governor at that time negotiated a contract to pay all of these employees this money. It was never paid. So we've been hearing about this retro payment forever. John DeYoung in his administration gave $40 million on that payment. We gave $10 million last year on that payment. This year we're going to give $40 million again, which will reduce the overall payment that is now due to $135 million. And then I committed to, as long as in office, to do at least 25 every year. So if we really do 40 next year, 40 the year after, and then another, I think, another 40, that'll get us right up to 120. I think we can retire this debt before I leave office for my second term, God willing, which is what the goal is to do. And the reason why we're able to do that is because, remember, we worked with the delegate, and she was very successful in getting the earned income tax credit reimbursed now for our taxes. So next year, we won't have to pay out $100 million in tax returns. We'll only have to pay out about $25 million in tax return. The other $25 million, even after we pay it, it'll be reimbursed by the federal government. So we could take that money and now put it towards retiring this debt. So we've been planning this for quite some time now on how do we get all these debts paid off. And I promised the retirees and the people who got the retro due that I would, once I finish fixing the system, I would fix this. So what we're working on is that, and to Lasiba's point, really paying off the entire and fixing WAPA once and for all. So those are our immediate goals right now, and then home ownership and education. So really driving those things home, I think we can eliminate. We've already managed to eliminate some problems that plague us for decades in our first term. In our second term, we'll be able to eliminate WAPA, start to rebuild on both our hospitals, and education, schools, and stuff will be well underway.
Oh, that sounds very good.
Yeah.
So about how many employees will you be paying this retro to?
I think it's
And
60.
is it retired and?
Yeah, it's retired and active. It's about 6,000 employees.
Okay, thank you.
Thank you so much, Susan. Ernest Gilbert?
Hi, good afternoon. Janika Simon, not Ernest Tippy.
Go ahead.
Janika Simon from the editor, so I haven't met you before. On the panel. My question is for Director Jashin, and I don't know if you would want to weigh in on this, Governor. Um, I understand that the water situation on St. Croix has improved somewhat. There are approximately 4 days of reserve storage, but that the director indicated that at one point water storage had gone down to about 2 days worth. I'm just inquiring what is the contingency for if it dips below a critical level? What are the current plans in place to get water to St. Croix in case the desal plants just are inundated with sargassum and the water storage capacity dips below a critical level? And what is that critical level that has been assessed?
Hey, thank you for the question. There's two approaches to this. Once we stood up the federal response plan, they do have under the federal dollar right now a contingency to bring water into the territory if we need it. They already had pre-positioned when we first started this back in July, approximately 416,000 liters of water, as well as 20,000 tankers, 20,000 gallon tankers to provide support to us. Additionally, we did stand up our private sector under DLCA with Commissioner Emilista, as well as Director Wilbur Francis, to talk to the private sector about their capabilities for water production, water generation, which is very, very good. So we started those conversations just to make sure we could have those going, primarily focused on the consumable water, potable water. We also are working with the hospital as well as the Caribbean Kidney Center to make sure those critical sectors can be looked at for water support for that. So we've already stood up a couple of plans for that. The trigger right now, I would say, is up to the CEO of WAPA. We haven't sat down at that level yet, but we've seen this 2.6 was a concern for us, but now we're back up a little bit later level. We want to increase the supply to about 11 days is our goal right now. So right now we're looking at that going forward. Each day is getting better and better with this desalination plant and cleaning out some of the sargassum that's been decomposing. But we already worked through those coordination, and again, with the federal government help and support, as well as the private sector, we'd be able to provide some of that response here on St. Croix. But of course, close to 2.5 million gallons a day is quite a bit to support the territory.
Am I allowed to ask a follow-up question? Okay, so my follow-up to that would be whether the private sector cooperation that you spoke about, whether that is going on right now, and if not, why not activate that so you could get up to the 11 days instead of waiting for the current water production capacity to catch up?
That's a WAPA call.
Yeah, it definitely goes back to Water Power Authority, their decision. Right now, we're trying to eliminate the threat, if you will, and then get these systems to go back and regenerate. What's really causing the downturn is the amount of time it takes to clean these filters and having to take all these units offline with the 3.7 million gallons per day. But we constantly are having coordination both with Water Power Authority and the private sector, but we're keeping the two of those separate right now with our courses of action.
So the other thing I want to mention too is that WAPA had a low reserve anyway because we're in a vicious drought right now. I mean, everywhere is brown. So we're not only supplying more water because more customers are using water on the system, but also more water trucks are coming for water every day. Just an update, I think we're up to almost 4.8 million in premium pay and 2,769 workers have been paid so far, just to let people know, because I get that question every time I'm in the public. Any more questions? Awesome. Hearing
Thank
none.
you so much. No question.
Thank you so much. Hearing none, I'd just like to wish everybody, hope everybody has a great week. Last week we sent everybody to school. We went out there last Monday, we visited. Seems like everything is going very smoothly. We have our usual set of little maintenance mishaps here and there, but everybody returned to school well. We look forward to doing more. Hope you all have, as I said, a fantastic week. God bless. Love you.